Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 12 homeopathic remedies for whooping cough. But before giving the indications of homeopathic remedies, let us have the preliminary ideas about whooping cough. What is whooping cough? Why does it occur? Whooping cough is a severe respiratory infective disease caused by bacterium Bordetella pertussis. Subjects become breathless for incessant unrelenting cough, which ultimately stops with a sound whoop, wherefrom the name arises. Its other names are pertussis or 100 days cough. Who are affected with whooping cough? Individual of any age and sex may be a victim of whooping cough that may prove fatal, especially in case of children. What are signs and symptoms of whooping cough? Number 1, cough, cough and cough. Face of person gets red and then blue. Cough ultimately stops with a sound whoop. Number 2, vomiting. Number 3, fever. Number 4, breathlessness. In severe cases, it often gets complicated to cause bacterial pneumonia, middle ear infection, hernia, encephalitis, and even death. How does whooping cough spread? Droplets arising out of coughing, sneezing, laughing, talking, singing, quarreling are the sources of infection. How long does pertussis stay? Whooping cough may continue up to 7 to 8 weeks. What are the incidence of pertussis in Bangladesh and India? In Bangladesh, more than 30,000 cases are reported in a year, while the same for India is 15,000 or less. How pertussis be prevented? With vaccine DTaP for infants and children and Tdap for boys, girls, adults and pregnant ladies, whooping cough can be prevented. Healthy persons should never go close to the affected ones. A good practice is to wear mask. The images of vaccines given here. Can pertussis attack even after vaccination? Yes, it is possible. For after vaccination, immunity wanes with time. Unless booster dose is taken timely, whooping cough may recur. General management, stream inhalation, give patient liquid nutritious foods and drinks. Potency, dose and repetition of remedy. In initial stage, 6 to 30 potency too early or 4 hourly for 2-3 days. Later, depending on situation, frequency of repetition may be decreased, or 200 potency 2 to 3 doses may be given with 3-4 days interval. Again, in second prescription, new remedy may be considered. It depends on situation. Whether the same medicine will be frequency will be less and less, or you have to give the higher potency, or you have to change the medicine completely. Everything is possible in second prescription. Now the medicines. Aconite for whooping cough. Attack comes suddenly from exposure to dry, cold wind. Patients restless, anxious, whistling, whooping cough. Burning, stinging in larynx, but no expectoration. Cough dry. Suffocating, loud, rough, croaking. Very rarely during day, expectoration of mucus with coagulated blood. Ambra for whooping cough. Severe paroxysm of hollow cough, worse during morning, evening, night. Expectoration of great quantity of tough, yellowish or grey mucus, especially after waking in the morning, having taste salty or sour. Abundant eructation with cough, worse from talking. Patients sad, weep for days together. This is general symptom, last line. This is a general symptom of the patient of Ambra. Antimonium crudum for whooping cough. Patients, especially children, fretful, peevish, cannot bear to be touched or looked at, sulky, do not like to speak or be spoken to. This we get in Silesia, Antimonium, idiom also. Angry from little attention. Great sadness with lachrymose mood. Graphitis falsatilla also shows this symptom. Irresistible desire to talk in rhyme and repeat verse. Sentimental mood in moonlight. This is an exceptional symptom. I have underlined it. Mind it, if you get this symptom, you can directly give antimonium crudum. Whooping cough from deep in abdomen in the morning with expectoration of tenacious bloody mucus. Vomiting of drinks only, not food. Loss of voyage, worse from becoming overheated in a warm room in the sun or from washing or bathing. Antimonium tart for whooping cough. When patient cough, there appears to be large accumulation of cough mucus in the bronchi. It seems that much would be expectorated, but nothing comes up. Worse, cough worse when child is angry or after eating. Arsenicum album for whooping cough. Patient restless, anxious, despair of cure. During paroxysm, face puffed and blue, burning in throat, nausea, retching, clear, ringing, crowing, and whistling cough excited by burning, tickling in the trachea and throat pit. Before paroxysm, face pale, cold, vomiting of food and drink, starting up from sleep as if suffocated, worse, midnight, midday. Symptoms getting worse midnight in midday is a characteristic symptom of arsenic, mind this. Write a card for whooping cough. Whooping cough in old men and atrophic children with roughness in throat, tickling sensation in the pit of stomach. Pit of stomach and throat pit. These two separate things. Throat pit means the pit show just above the sternum bone, and pit of stomach is another pit just showing at the end of the sternum bone. Worse from getting feet wet, sleeping in cold room, lying on left side while thinking of the disease. Expectoration yellowish, starchy, tenacious, often salty with swelling of tonsils from slightest cold, loss of voice, drowsiness and chilliness day and night. Most efficacious for children, childish old people, not children, childish old people with idiocy liable to catch cold easily. Also very much befitting for idiotic, dwarfish, inactive and highly lazy children. Chamomile for whooping cough, specially suitable for hot, highly choric, irritable, uncivilized, cross, snappish children. They always whine, want this or that, but when offered, reject those instantly. They love to be carried away. Early catarrhal stage with dry, tight, hollow, suffocating cough. Tenacious mucus difficult to expectorate. Wheezing, rattling noise during inspiration, disappear on coughing. Worse, daytime, hardly any at night. That is, in night there is no cough, no trouble. Cough and vomiting mostly during meals. That is, while he is taking meals, cough and vomiting during that phase. Calcarea cough for whooping cough. Of repeated short spasmodic cough exciting by tickling down in throat and trachea. Profuse mucus and purulent, yellow or grayish or sometimes bloody sputa of sour taste and offensive odor during morning and day, but not during evening and night. This is very important symptom, mind this. During this sputa characteristics, mucus characteristics are shown in the morning and day, but not during evening and night. Worse after sleep, from talking, bathing, washing, getting wet in damp cold weather. Very much befitting for children with flabby muscles who sweat easily, catch cold easily, crave eggs, but aversion to meat. That is Calgary cough. Generally, it is general symptoms of Calgary cough. Patients love eggs, they are averse to meat, they sweat profusely, they catch cold easily, they have flabby muscles. This is Calgary cough symptoms. Sheena for whooping cough, specially suitable for obstinate, very cross, irritable children who do not want to be touched, cannot bear one comes near, averse to caress, want many things but reject them when offered. Chamomile, already described. Pick nose always, rub nose on pillows, on shoulder of mothers, nurse, etc. Weep pitifully when awake, start and scream and grind teeth during sleep. Ravenous hunger before attack, spasmodic gagging in the morning, after attack vomiting of food, mucus and bile, thereafter again hungry. Afraid to speak or move, lest paroxysm of cough appears again. This vomiting and after vomiting getting angry, hungry and again vomiting, this often goes cyclically. This is a peculiar symptom of Sheena. The patients after food vomits, vomiting foods, maybe mucus, biles, then he again gets hungry. He takes the food, again the same thing happens after taking. The same thing happens, that is cyclically, sometimes it goes on cyclically. Corallium rubrum for whooping cough. Fits of fierce spasmodic cough commencing with gasping for air, crowing inhalation till the patient grows purple or black in face and fully exhausted. Worse in later part of night and morning. Upper part of respiratory tract involved compared to chest. Loss of appetite and thirst. That is, corallium rubrum patient has no thirst or desire for food. Drosera for whooping cough. Whooping cough in periodic returning spasms made up of quickly succeeding barking cough which do not allow the patient time to recover breath. Excited by sensation of dryness or feather in throat, cough starts. After cough, bitter yellow expectoration which the patient has to swallow. Worse after lying down after midnight by laughing, singing, weeping, child holds both hypochondrium during cough. Hypochondrium is just on both sides of epigastrium, that is the region of stomach, pit of the stomach. Down pit of the stomach, the area is called epigastrium. On both sides lies hypochondrium. On both sides, this hypochondrium, the patient child holds and then cough. Retching, vomiting follows if sputum is not raised. Hydrosonic acid for whooping cough. Violent paroxysm of cough or frequent cough due to pricking sensation in larynx down to trachea, with dryness of mouth and throat, weak, slow, anxious respiration, with much rattling of mucus. I've given you one information. If you like to know more remedies about whooping cough, please consult Homeopathic Therapeutics of Dr. Samuel Lilienthal, a world famous book. You can get there some 60-70 numbers of medicine for whooping cough. If you really like, you can go and check. With this, the video ends. If anything you feel troublesome with this video, please write down in the comment section. I will certainly reply. Thanks for listening and viewing.